Hello everyone. So we always talk in our videos about challenging DMEK cases or doing the DMEK or unfolding the graft in different situation or unusual situation. But today we'll talk about the graft itself and about the different way to prepare the graft. Some people are really well blessed that they have already the grafts pre-prepared, and other people or other surgeons have to prepare the graft themselves. In this episode, we'll talk about a technique that I find it easier, much simpler, and more reproducible. Plus, I'll share the usual technique that I used to use before swapping to the new one. This is Dr. Hosny. I'm a consultant ophthalmic surgeon in London with a special interest in cornea, anterior segment, and cataract surgeries, and you're watching now the SeeLife podcast. So as we can see, that preparing of the graft is a very important, essential step in the DMEK surgery, especially in center that gets the whole cornea and not get the graft pre-prepared as other places are doing. I had the great opportunity to see how the preparation of the graft is going in the cornea bank in Alabama and in North Carolina, and I have learned a lot from them, but their technique is very neat and take a lot of time to be done. Usually when they are preparing for a large graft like 10 millimeters, it takes a long time and might take as well 2 to refine, which is more expensive cost-wise. For this occasion, I would like to make a shout out for my great friend and the fantastic DMEK surgeon, Dr. Jack Parker in Alabama at Parker Cornea. And I want to congratulate him for the new cornea bank that he's about to do in Parker Cornea. And he will be using the organic culture more than the Optizol. As well, I would like to congratulate him and all the cornea team at Parker Cornea for having the new hospital that they are about to launch in the next few months, as I said. Let's now play a video for the graft preparation, and this is the old way I used to prepare the graft before. So as you can see, after I peel the graft, what I do is I first try to iron the graft. I try to use the 3 millimeters punch to refine to cut a circle in the graft after moving away from the distal membrane shortly. And after that, we get back the distal membrane in its place, and we try to iron it again and dry well. Then the next step is to flip the graft. And we want now to remove this cap. As well, we need to dry it well so that we can do the F mark. Sometimes we don't have the F mark ready, so we can use the Sansky hook and draw the F mark ourselves. And we, after that, dry well and put the cap back and reflip the graft and continue the preparation as usual by cutting the graft and peeling, as we can see. Then we peel the membrane after. So this is the way that we used to prepare the graft before. I find it's a very good way and it's reproducible, but it takes a longer time. Plus, it's kind of a lot of steps to do. So once I was talking to a friend that he was doing his preparation in a different way, which is, I found it much simpler, easier, and reproducible as well. So I will show you now how we do. So this is a video showing that I was preparing one of my grafts the same way. So just it's a good as well occasion to show how we prepare the graft. I just do a mark to know from where I start. I put my vision blue or membrane blue, whatever you have. And just I do it this way. Actually, I don't move the Sansky hook too much. I just rotate the graft in this way. It's much easier. And I check the edges of the graft that they are free, 360 degrees. Then I will, yes, we just came here to the start point as well. So we will start to peel the graft. That's, put some fluid so that it will be a scuba technique. It's much safer, and we peel the graft. So after drying well, I will put the air cannula, the Rancroft 30 gauge, and inject a tiny bubble of air. So when I inject a tiny bubble of air, I just dry it very gently so I don't lose the bubble that we are doing. And after that, I will prepare my F mark or S mark, or even draw the mark with the Sansky hook as we are doing here. And while we are doing this, we are be very gentle. This is another video showing that the bubble was getting small. There is no worries. If the bubble is that size, it can do the job as well. So here, I think we have the F mark ready, and we just stamp it on the desmoid membrane backside, the corneal side, I mean. Then after that, simply we just get the graft back to its place and iron it and dry well. Then the next step definitely will be refining the graft. As you can see, just as usual, I do it in a very gentle circular way. And sometimes you can tap as well with the back of the forceps in a circular way. Then you will have your graft ready. This technique, I find it actually, it's much easier. Plus, if you are in a center that have the license to use one graft for 2 patients, that's actually a very good technique that you don't have to, you spare the rest of the cornea, so you can do it in another patient who need, for example, a bulk surgery. I will show you another video as well that I prepare the graft if I have actually a very opaque cornea. I do the bubble and do the F mark as well, like after I dry. It's good to see like a few videos so that we just make it easy for us to understand it, and print the F mark. After that, I just iron it again. So in this cases, which I have a very opaque cornea, I do the F mark plus I do the arrow, which actually I found it very helpful and useful with the F mark. After I doing the refine here as usual, and after that we will take care just not to get the graft with you, be very gentle, and we'll access the membrane just around. See here, there is like a defect, so I say I'll do the arrow there in this defect. You get the arrow here, and you start to peel your graft. First, I like to see if I can do like I just remove the membrane on the arrow, and after that I will peel the graft very gently, and that's it. A nice tip I would like to add while injecting this air bubble, at the start actually it wasn't reproducible for me every time till I started to use the 1 millimeter syringe, so it was less air injected and more controlled. One thing the surgeons have taught us is to keep evolving our own techniques and not to change the technique because it's just new. We can change it because it's much simple, reproducible, and safer. Because the less you manipulate the graft, the happier the graft. At the end of this video, I would like to hear from you here in the comments down below. What's your preferred technique? Are you using the S mark, F mark? You have something new that we haven't heard about? So I would like to learn from you as well about this. And we always remind ourselves and remind myself that we are not doing this video only for doing like fantastic surgeries or preparing graft in the best way. Our aim always is to help people to see life again. Thank you very much, and if you like the video, please subscribe in the channel and press the like button and share it with your colleagues so all we can benefit from each other. Thank you very much, and see you next time.